Well, welcome to our presentation on early intervention. My name is Betty Baez. I'm with Advocates for Children of New York. I lead our early childhood education project, and we're going to go over the early intervention process for infants and toddlers with developmental delays or disabilities. This is an overview of our agenda today, everything that we'll cover during this presentation. We're going to start with giving you some more information about AFC and also Together Growing Strong, an agency that we're partnering for this presentation. Then an overview of early intervention, generally, what the program is and services available, the process for getting those services, for making the referral, requesting services and evaluations, what services are available and how to get those in place. We'll talk about the transition to preschool special education when a child is turning 3, an overview of all of your rights within the early intervention program, resources in case you run into any challenges, and we'll have an opportunity for questions, not only at the end, but throughout the presentation. No. So, what is Advocates for Children? AFC is an independent agency that protects the rights of all New York City students. And we do that by providing a variety of different services and resources for families. One of the main areas that you can get in touch with us and receive help is by contacting our helpline. Our helpline is free of charge. It's open to all families or any professionals with an education-related question. And that includes any questions about early intervention, so starting from birth. Our helpline number is 1-866-427-6033. It's open Monday through Thursday, 10 a.m. to 4 p.m. If you don't reach someone when you call, please leave a voicemail and we try to get back to you as soon as we can. We also provide free legal services to low-income families. We have limited capacity, but to the extent we can, we really prioritize families most in need for legal representation to help them in cases in order to secure, be that private services or private school placements or other remedies to make up for failures in their child's education. We provide guides and resources. All of these are available on our website, and you can follow this link here. We also do workshops and trainings, so webinars like this one, but also in-person workshops and fairs. If you're interested in any of these, you can request workshops through our website, and you can also find recordings of previous webinars on our website. And we work on policy advocacy and impact litigation, and this is to try to achieve change on a large scale, so both on the city and state level, in order to improve educational outcomes for all students. And now from our partners at Together Growing Strong.
Thank you so much, Betty. Thank you for joining us this afternoon. My name is Gemma, and I'm one of the program coordinators for the Together Growing Strong Care programming. We're based in Sunset Park, and we are a community-based program that focuses on providing support to families, caregivers, providers, and school administrators that interact with children, um, young children up to the ages of 7 years old. Our program is completely free and it offers virtual webinars such as this one on a variety of topics that's related to child development and health. For children, we offer monthly read out louds to read stories, and throughout the storytelling, we ask questions to engage the children and help them expand on their vocabulary. We also host monthly playgroups to give children the opportunity to interact with other children their age and learn about different cultures through reading books and crafts that are developmentally appropriate to them. To address food insecurity, we offer our monthly food pantry for families who are interested. During the summer, we also offer specific workshops to assist parents who have children in pre-K to transition easier into kindergarten. And at the end of the year, we have our annual toy drive, which is specifically for our families who have been involved in our programming, both virtual and in person. We call them at the end of the year around December to pick up toys for their children. So if you're interested in our program, you can drop your name, your full name, and telephone number at the bottom. Or you can give us a call to 646-530-5488 or 646-530-5461. Thank you, Betty.
Thank you, Gemma. Okay. So moving on, what is early intervention? Hopefully, if you're joining this webinar, you already know some of this. But early intervention is a free program that provides services to infant and toddlers with developmental delays or disabilities and to their families. So it is a family-centered program with services in the child's natural environment or where they already typically spend the day. Early intervention is run by the New York City Department of Health and Mental Hygiene, or DOHMH. It is not considered an educational program. It is not run by the Department of Education. It is within the Department of Health. And so, just to start off, I see we have now participants. So, a little bit of trivia, true or false? Only a pediatrician can tell you if a child needs early intervention services. Okay, we've received the results. Many of you answered true. The correct answer is false. Um, while the pediatrician can be really instrumental in letting a family know if they should consider referring their child to the early intervention program or helping identify potential delays or diagnoses, um, any family, any person, including the parent, can refer their child to early intervention services. And after you make that referral or request the services, your child will receive evaluations. And based on those evaluations, your child may be found eligible for early intervention. So it's not just a pediatrician, although a pediatrician can be very helpful throughout the process. So can other professionals like daycare workers and similar. Professionals who have a lot of experience working with your child, but a parent is able to make the referral on their own. And in fact, even those professionals cannot make a referral unless the parent consents, or unless if the parent objects, they're not able to do so. So the correct answer is false. Okay. So, who is eligible? As I said, anyone can request evaluations, and then eligibility will be determined based on a set of criteria. And the early intervention program is available to a child from birth to 3 who has a developmental delay, and that can include a delay in one or more of these 5 areas of development. Um, the areas of development being cognitive, so how a child is learning, communication, both how they're expressing themselves, but also understanding language, physical motor, their movement, their ability to crawl, walk, grasp things, social emotional, how the child is interacting with other people, with other children, with their parent, and adaptive self-help, especially as a child is getting a little bit older. Are they able to help? Feeding themselves, help with cleansing and other things. So those are the 5 areas of development. And if a child has a significant delay in one or more of these areas, they may be able to qualify. So to qualify, a child should either have a delay, a 12-month delay or 33% delay in one of the areas of development, or a 25% delay or more in at least 2 areas of development. Um, the exception here is communication. In order to be eligible, if the child's delay is only in the area of communication, the delay needs to be more significant than a 12-month or 33% delay. And when, these terms may sound odd to say, how do I know it's a 12-month or 33? That's the really specific amount. That's what the evaluations will help determine. They are able to determine based on the development of other children, the extent of delay a child has. The other form of eligibility, when we say EI is for children with developmental delays or disabilities, the other way a child is eligible is if they have a diagnosis that's likely to lead to a developmental delay. There is a formal list, and you can find that list here linked on the slide. That includes Down syndrome, cerebral palsy, genetic disorders. It also includes autism. Just so that you know, we are recording this webinar. It will be posted on our website along with the slides, and so you will be able to access the PDF of this slide on our website with all of the useful links. So the early intervention process generally. The process starts with a referral with the request for evaluations, the request to see if your child is eligible for services. Upon making that request, you'll be meeting with a service coordinator, your initial service coordinator, who will go over the evaluation process and go over all of your rights. You then have the process, have your child evaluated to see if they are eligible. There will be an IFSP or Individualized Family Services Plan meeting. If your child is found eligible, this is the meeting where services are recommended, and you get to know exactly which services will be provided, when, and where. And finally, there's implementing and reviewing the IFSP periodically to make sure it remains up to date. This is a broad overview of the process, and I'm going to go over each of these steps in more detail. So, the referral. Who can make the referral? We went over this a little bit with our first trivia, the parent. Um, the parent can make the referral on their own by calling 311 and requesting early intervention. Other people who can make a referral include professionals like doctors, nurses, staff at childcare centers, staff at shelters. These are professionals who come into contact with the child or with many families and are usually able to help identify a child who may have delays that could benefit from these services. These professionals are required to make a referral unless the parent objects. So again, the parent is really central in all of this process. They can also make a referral by calling 311. There's also now a referral portal, and this is available to parents and professionals to allow you to make referrals online. The link is nyc.gov/health/EI-referral. As I indicated, it is hyperlinked on this slide, and you can access it on our website. This is a new portal where you can enter all of the information online, and then we'll hear back from a service coordinator. It just launched a few weeks ago, and so hopefully it's working out well. It should really be streamlining the process to make sure that they're gathering all of the relevant information that they would need, and are well prepared to call you back with an initial service coordinator. So you make the referral, you make the request for evaluations, or you make the request for services. The next step, as I mentioned, is meeting with the initial early intervention service coordinator. This person will reach out to you, to the parent. And this is a really important meeting where they're going to go over many different things, including inform parents of their rights, including their right to an evaluation, their right to move forward with the process, also the parent's right to end the process at any stage that they choose. The service coordinator will discuss the evaluation process and help choose an evaluator and help the family make an appointment. So it's really hands-on support together to choose which agency will conduct the evaluations, which one is more conveniently located, or which hours work best, and help make that appointment, schedule that appointment. So at the end of the meeting, hopefully you are very aware of all of the next steps. During this meeting, the service coordinator should also explain that early intervention is free. It is at no cost to the parents, but the EI program will ask you for your insurance information, including Medicaid information. The program does separately seek reimbursement from Medicaid and from health insurance. And during this initial meeting, they should explain to you the individualized family services plan. And again, we'll go over this in more detail, but this is the document or the plan that identifies, summarizes a child's strengths and needs, and also lists the services that a child should receive if they're found eligible. Okay. So the evaluations themselves. Evaluations must be done by at least two professionals, and it should be across all areas of a child's development. So these areas of development, I went over them earlier, but include cognitive, it includes communication, adaptive self-help, social, emotional, and physical gross motor. So even if you are making a request because you're concerned about delays in your child's communication, they should still be the evaluation should still assess all areas of development as well. There is a health assessment. Usually this part is done by the child's pediatrician by completing medical paperwork. There's a parent interview. Obviously, the parent, you're the one who knows the most about your child. And so you do an in-depth interview where you go over the history with your child. So it may include the parent if the mother can talk about their pregnancy, if the parent can talk about the pregnancy, and any developmental milestones that the child has reached since birth. There's a review of records, depending on what records the parent is able and willing to share. Family priorities, resources, and concerns. Again, this is a child and family centered program, and so there are resources also available to support the family in helping the child. A transportation assessment in case the family will require transportation support in order to benefit from the early intervention services, and as well a voluntary family assessment. And again, that's if the family is choosing to also benefit from additional support outside of the supports available to the individual child. I will pause for questions to see if there are any questions in the chat or in the Q&A.
So far, no questions, Betty.
Okay, thanks. Then we will keep going. So after the evaluations are complete, there should be an IFSP meeting. This is the meeting to determine if a child's eligible and what services they will receive. So the IFSP team must include some key players. Um, and I will just put them all out on the table first. The most important person is the parent or the parents. You are the person with the rights with regards to your child's services. And so you would determine if you're continuing in the process, but you also have so much information to share about your child's development, your child's strengths, and your child's needs. So it's very important that you participate and actively contribute in the IFSP meeting. And so every effort should be taken to make sure that you are participating and that it's in a time and place that is convenient for the parent. The service coordinator should also be present. This is the person who will also then be responsible for making sure services are in place for the child, and will just be generally the person overseeing the child's IFSP. There should be an EI official designee, or EIOD, an evaluator or representative from the evaluation agency who can help speak about the evaluation results or the findings, an interpreter if the family speaks a language other than English, and other persons that the parent may choose to invite. And so, for example, if the grandparent is also a caregiver for the child, and the child spends most of the day with the grandparent. You may choose to tell your service coordinator before the meeting, I'm going to have the child's grandparent attend. If the child has complex medical needs and their pediatrician is able to join a phone call during the IFSP meeting, you would notify your service coordinator beforehand that you would like them to attend. Or if you're working with a service coordinator, an advocate, or other person with familiarity about your child who can support you during the meeting, you can make that request as well. So together at this IFSP meeting, you are developing the individualized family service plan. And we're going to go over all of the sections included in the IFSP. It starts with the current levels of functioning. A lot of this is based on the results of the evaluations or the assessments. It's also based on what you as a parent are reporting to the early intervention program and during that interview. There are for children recommended for services, it includes the services, how often a child should be receiving those services, for how long those services should last, and the start date. So, for example, if a child is eligible or found eligible for speech therapy and is going to be receiving speech therapy services, the IFSP should indicate how many times a week. So, for example, 3 times a week. For how long? Are they for 30 minutes, for an hour? Where those services should be taking place, and when those services will start. So how soon after the IFSP meeting will those services begin? Should include the location for services. For the most part, IFSP or early intervention services should be provided in a child's natural environment where they are typically spending the day. So for many children, that may be their home. It could also be in a daycare program, or as I said, in the home of another caretaker. The IFSP should include outcomes and objectives, things that we're hoping a child will be able to accomplish with the early intervention supports that they will be receiving, and if transportation will be necessary. And so, for example, there are children who, with really significant needs, who will receive services or may be recommended for services at a center-based program, and will involve travel, busing potentially to and from that center-based program in order to receive all of their services. So that would all be included in the IFSP. And just so that you have some sense of what it all looks like, I'm sharing this IFSP template. Won't go over every single section with you, but it's just so that you have some familiarity, and know generally where to look for in all of these forms. This is several pages long to find information that may be most relevant to you. So this is the cover page of the IFSP. Down here, this image is a link to where you can find a blank template. Um, just so that you can see right off the bat, it includes a child's name, their early intervention identification number, date of birth, their information specific to the child. Also indicates which IFSP meeting this is, whether it's the initial or one of the review meetings. As I indicated, part of the early intervention process is to revisit the IFSP periodically. There'll be information about the parent, the child's background, and their address, who is participating in the IFSP meeting. So as you can see, parent, legal guardian, required members, and that's why there is a checkbox for them, as well as the evaluators, the service coordinator, and other necessary participants. On page 2, we start getting to the concerns, including parent concerns and evaluation results, to better understand the needs of the child. We also there's a page to identify priorities, as we indicated, kind of objectives that a child will be able to reach, additional goals and objectives in each area. You can do these for each area of development. And this is one of the key pieces of information, the service recommendation frequency and location. So if a child is recommended for services, it should all be outlined here, including the start date. And as a child is getting older, so as they're getting closer to 3 years old, an opportunity for transition planning to help prepare for when they age out of early intervention, and may be eligible for other programs and services. So, what type of early intervention services are available? Some of these are the most common are speech therapy, occupational therapy, physical therapy. These are to support those specific areas of development. There can also be special instruction and applied behavioral analysis. These we see most commonly recommended, for example, for children with autism who can receive one-on-one intensive ABA therapy to help with their development and their growth and learning. Um, IFSP, as I indicated, can include supports not just for the child, but also for the parent or the family. So including family training, counseling, home visits, the opportunity for transportation, assistive technology. We don't see recommended as much for early intervention, but it is available. This can be a device or equipment that helps a child either with their communication or in another area of development. And so especially for children who are a little bit older, who are not yet verbally communicating, one common form of assistive technology we see is a communication device, which is like a tablet that a child could use to point at words in order to have the tablet say aloud key phrases. For example, if the child is hungry, they can point to what food they would like or that they want water or something similar. So starting IFSP services, the service coordinator the service coordinator is a person who's responsible for making sure all of the services are in place, and they will identify the providers and arrange the services. And services should start within 30 days. As I've indicated, the services should be in a child's natural environment, so where the child is already typically spending the day. And so for many children, it may be their home. If a child attends a daycare program, it can be in that daycare program. It is Very rare that a child should be asked to travel to a different location, although that option is available, as I mentioned earlier, for children with really significant needs who would benefit from services delivered in a center-based program. Services should only be provided with parent consent. If the parent does not agree to services or does not agree to one of the others of the services on the IFSP, the child will not receive those services. Um, Something that I want to mention too is services should be delivered in person. That is what the law requires, and it should be the initial option presented to the family. Telehealth is still in use, and so if the parent consents and agrees, services can also be delivered through telehealth. But are welcome. You may turn down telehealth and insist on your right to in-person services. When I say telehealth, these are services delivered through a tablet, a cell phone, through a computer, so that the provider is remotely working with the parent and the child, or an adult and the child, to deliver their early intervention services. It was something that was first developed during the pandemic in order to support children and ensure that they were receiving their services even throughout all of the challenges with the pandemic, but has remained an option. Although in-person services, you do continue to have a right to in-person services. So an overview of the timeline, I went over the process, and these are just some key dates to keep in mind as you go through that evaluation and referral process. So one of the first key dates is that the IFSP must be completed within 45 days of referral. That means that at the date you make the referral, that you request those evaluations, you already know that an IFSP meeting should happen within about a month and a half. So definitely no more than 2 months from your date of referral. These are calendar days. Another key date is that services must start within 30 days of the parent signing consent for services. And for many, this happens at the IFSP meeting. At the IFSP meeting, that you'll receive a service recommendation. If you sign consent, services should begin at least within 30 days of that meeting. Other key timelines to keep in mind in terms of how often the IFSP will be revisited is that an IFSP should be reviewed every 6 months, and every year should be reevaluated by the IFSP team. That doesn't necessarily mean that all new assessments will need to be completed, but your child's providers should be updating the team on progress made in order to see if there need to be any changes made to the child's IFSP. Okay. Went over a lot of information. So just going to check in to see how much of that you're absorbing. And um, yeah, in case anyone has any questions. So let's say you refer your child to early intervention services on September 1st. When should you have an IFSP meeting? Okay. So the correct answer is B, by October 15th, which is about 45 days from the date you made your referral. Okay. So you've made the referral, you had evaluations on October 15th, you signed consent for Amanda to receive early intervention services. By when should the EEI services start? Okay, and the correct answer here is by November 15th, or A. Services should start within 30 days of the parent signing consent. So 30 days from October 15th, more or less, is November 15th, although there are 31 days in October. So, but the correct answer is A. Okay, we'll pause for questions. And please put your questions in the chat or in the Q&A. Okay, I am not seeing any questions, so we'll keep going. There'll be another opportunity for questions in a moment. So early intervention services are for infants and toddlers from birth to age 3. So you may be wondering what happens at that critical age when a child will be turning 3. At that point, that's when you start thinking about the transition from early intervention to preschool special education. And this happens at the critical time around the child's 3rd birthday, because this is when eligibility for early intervention ends, and around the same time that eligibility for preschool special education services starts. In order to prepare for this transition, the early intervention service coordinator should start having the transition discussion with a parent at least 6 months before the child's 3rd birthday. And that's because in order for this to really go smoothly, there are a lot of important deadlines to take into account, and you want to be able to set your child up so that there isn't any type of gap in services if they are eligible to continue receiving services through preschool special education. All right, so just to hone in on what these key dates are that come into play around the child's 3rd birthday. When can preschool special education services begin? A child is eligible to start preschool special education potentially a few months before their 3rd birthday. It's based on when they're born. So children are eligible to start receiving preschool special education on January 2nd if they turn 3 between January 1st and June 30th, or July 1st if they turn 3 from July 1st to December 31st. So as you can see, a child born in June could start receiving early intervention services as early as January 2nd when they're about 2.5. They don't have to wait necessarily until their 3rd birthday in order to start receiving preschool special education services. And to say that to kind of reinforce that there is a period of time when children are potentially eligible for both EI and preschool special education. They can't be in both programs at the same time, but there are situations where a parent has a choice between which program their child should be participating in. Okay, so keep those two dates, key dates in mind, January 2nd and July 1st. Now, if a child is found eligible for preschool special education, they may be able to extend their early intervention services beyond their 3rd birthday in order to continue receiving early intervention services until a later date when they're ready to transition. A child could potentially extend their services either through August 31st or through December 31st, depending on their birthday, so depending on when they turn 3. So families are eligible to extend until August 31st if their child turns 3 from January 1st through August 31st. So again, here too, for children born in January, that's a pretty long extension after their 3rd birthday, where they can remain in early intervention potentially for another about 8 months until they're ready to transition to preschool special education at the start of the school year in September, for example. Families may be able to extend EI until December 31st if the child turns 3 from September 1st through December 31st. So here, these kids don't get as much of a benefit in extending, but that timeline does assist again to ensure that there is no potential gap in services and that the preschool special education program is ready to serve the child when the family is ready to start in that program. All the steps that need to happen in order for a family to potentially be able to extend early intervention services are that the family needs to refer their child for preschool special education, needs to have their child evaluated for preschool special education services, be found eligible, and have an individualized education program or IEP developed for their child. The IEP is similar to the IFSP for EI. It is the program or it's the document that gives an overview of the child's strengths, needs, and what program and services are recommended for the child within preschool special education. All of this needs to happen by the child's 3rd birthday. So that is why that your early intervention service coordinators should start the conversation with you about 6 months before your child turns 3. Because in order to stay in EI beyond your child's 3rd birthday, or in order to start preschool special education right around the time your child turns 3, or potentially as early as possible, you need to put in that referral that you proactively have to request from the Department of Education, Preschool Special Education Services, complete the evaluation process, which can sometimes take a couple of months, and have that IEP meeting all before your child turns 3. So it's a really important transition point, and those conversations should start with your service coordinator before your child turns 3 so that you're well prepared for it and it can go. It's designed to go smoothly and it's designed to prevent children from missing out services. So, to see if this is all sinking in, because I know I just went over a whole lot of dates with you, we're going to do some more trivia. Dylan is currently receiving early intervention services, and his birthday is February 21st. If found eligible, how early can Dylan start receiving preschool special education? The options are January 2nd, February 21st, February 22nd, or July 1st. Okay, here the correct answer is A, January 2nd. Dylan turned 3 on February 21st, so he's within that first category of children who is eligible to start. He was born in the earlier part of the year, so he's eligible to start early intervention, excuse me, preschool special education services as early as January 2nd. The other start date is in July for children born later in that year, or as early as July for children born later in the year. Okay. Um, so we're still working with Dylan, who turns 3 on February 21st. If Dylan is found eligible, how long can Dylan remain in early intervention? So if the family makes a referral for preschool special education, has him evaluated, and has an IEP developed, how late can the family extend early intervention services for Dylan? Okay. The correct answer here is August 31st. So congratulations to everyone getting these right. Um, because Dylan was born from January 1st through August 31st, he has the ability to extend through the end of August. If he were born later in the calendar year, he'd potentially be eligible to extend until December 31st. Okay. Still working with Dylan. If Dylan is not found eligible for preschool special education, when will his early intervention services end? Keeping in mind that his birthday is February 21st. Okay, the correct answer here is A, February 21st. If Dylan is not eligible for preschool special education, if he's not eligible he won't be eligible to extend services, then his early intervention services will end on his 3rd birthday. There's no benefit of at the end of the month. There's no benefit of, you know, any prolonged extension period. Services will end when a child turns 3. If they are not eligible for preschool special education. And I say eligible, but it also means if you didn't start that process, if there is no preschool IEP, services will end on a child's 3rd birthday. So in fact, Dylan, his last day of receiving services is likely February 20th. I hope that helped all of these dates sink in a little bit. Um, as I mentioned, we're going to go over a quick review of all of your rights. And when I say your rights, I mean specifically parent rights. You have the right to be involved in all stages of the early intervention process. Obviously, from referral, nobody should make a referral if you're objecting to it, to the evaluation process, at the IFSP meetings, and also throughout the process, getting updates from your child's providers, participating in those regular review meetings as well. The parent can refuse to consent or withdraw consent at any point in the process. You can choose to make the referral and to decide you don't want your child evaluated. You can choose to go forward with the evaluation process, but then decide you don't want your child receiving services, or you don't want your child receiving all of the services recommended, just some of those services. It is all based on parent consent. Parent is a very key player in this process. You have the right to request full evaluations in all areas of development. You may be offered the chance to just to do a screening, or to focus in on just assessments in some areas for your child. You do have a right to request full evaluations across all areas of development to get a full understanding of your child's strengths and needs. Family has a right to choose an evaluation agency and the service coordinator. And this is one of those things that the initial service coordinator is there to support you with. You have the right, the parent, to receive copies of all evaluations, IFSPs, and other documents, and to receive them in your home language. So if you speak a language other than English, if you're working with a family who speaks a language other than English, let them know that they do have a right to documents in their language, and also, obviously, at any meetings, rights to interpretation, so that they can fully participate in IFSP meetings and other meetings relevant to their child, and the evaluations, of course. Family can request new evaluations if you disagree with the findings of the initial evaluations conducted through early intervention. Parents can refuse a specific service without losing the right to other services. So if an IFSP recommends speech therapy, physical therapy, and ABA services, but a parent believes that a child doesn't need the physical therapy or doesn't want the physical therapy services, for example, can turn down the PT services while the child will still be receiving the speech and the ABA. This is different from other programs, and so do want to flag this, that it is a right within early intervention to refuse part of the IFSP while still being able to continue with other services on the IFSP. And the right to confidentiality. This is all within the Department of Health and Mental Hygiene, or Department of Health. And so these are confidential records related to your child's health, just like other medical records are also confidential. And if a family runs into challenges, if services aren't being provided, do have the right to due process. And I'll go over three processes that are available to families, or three different outlets that are available to families who feel that their rights have been violated, in order to seek remedies for those violations. Um, so before getting to due process, if you run into complications or issues in securing services for your child, delays in the IFSP meetings, if services are only being offered in telehealth and you need them in person, any of these challenges arise, the first step should be to contact your EI service coordinator. As I mentioned, this is the person who really oversees your child's IFSP. They're the ones responsible for identifying providers, making sure services are in place. So this is your primary contact throughout the process. So you should have your service coordinator's contact information, their telephone, their email address, the agency that they work for. And so as a first step, would always recommend reaching out to your service coordinator. If the service coordinator is unresponsive or not able to resolve the problem, there are regional offices for each borough, and have included the telephone numbers here for each of those. Recommend that you reach out to the regional office for support. If that is still not resolving the issues, then there is an Office of Early Intervention Consumer Affairs. They have a telephone and an email address, and do recommend that you contact Consumer Affairs, again, with any challenges relating to your child's IFSP. The telephone number is 347-396-6828. The email address is eiconsumer.affairs@health.nyc.gov. Advocates for Children, we have an email address that you can feel free to copy us at earlyintervention@afcnyc.org. This is so that we can hear your concerns and monitor the consumer affair inbox's response. It doesn't mean that we are going to be able to proactively assist in your case, but it does help us identify trends. And if you follow up on that correspondence, we may be able to offer some assistance. And then there are the due process rights, which I mentioned earlier. And so these three are three of the main mechanisms for notifying people that your rights have been violated and seeking to resolve the issue. Would recommend that you first start with the contacts we just listed with your service coordinator, regional office, and consumer affairs, but those are not required. One process that you can consider pursuing is a system complaint. This is writing a letter basically to the state indicating your concerns with the program and asking for a resolution. When a complaint is received, it must be investigated and you will be contacted about that process. We have more information about the systems complaint and all of these in our early intervention guide, and I will be linking to that in the end, including where to send your complaint. There is mediation. Mediation has to be done by agreement. It is when the family and representatives from early intervention agree to meet to see if they can come to a mutual understanding to resolve the issue. The mediation is led by a mediator, which is a third party person who's there to see if they can facilitate an agreement between the parents and the early intervention program. There's also an impartial hearing, and this is more like suing the Department of Health. This is when it is overseen by a administrative law judge or a hearing officer, who is a person who will make a decision about which party is right. And so it is usually started by a parent bringing a case against the Department of Health or Department of Health and Mental Hygiene, saying that their child's rights have been violated and what it is they're seeking. And this judge may hear evidence or testimony. It is a formal process, and then we'll make a decision, a written determination about the case. And so for that process, for impartial hearings, we usually recommend that a family consult with a lawyer, although a lawyer is not required to bring a case. A lawyer is not required for any of these processes, but if you are able to access one, it may be helpful. Okay. So an overview of AFC resources. These are just some of the many publications that we have on our website. I've specifically listed ones relevant to early childhood education. I won't point them all out or go over all of them in detail, but I do want to highlight our developmental milestones. This is based on CDC milestones, and it is an overview of what skills or abilities children are demonstrating at different stages of their development. And so, for example, at 6 months, we'll give an overview of what most children are able to do in the area of communication, self-help, cognitive, social, emotional, and that's to really give families a general idea. You may be suspecting that your child has a delay, and so it would be good to reference the developmental milestones chart to see if it seems to be that your child is maybe demonstrating a 3 month or 6 month or significant delay, and whether you may want to make a referral to early intervention to have your child evaluated. We have a comprehensive guide to early intervention. This guide is a detailed overview of everything I've gone over today and more. And this is also where you can find more detailed information about those due process rights that I just went over. For children who are transitioning, we also have the guide to preschool special education. And both of these guides go over that transition from when a child is turning 3, from early intervention to preschool special education. All of these resources are hyperlinked here and are available on our website. Our website also has resources for much older students, for children from immigrant families, children in foster care, and all of the other projects that AFC has and all of the other populations that we serve. These are some resources available on early intervention outside of AFC, including CDC resources that help you better understand your child's development. The city has an early intervention website. There's an early intervention state website as well. You may find templates here, but also contact information for people who can assist you. So for the regional offices, for example, in consumer affairs, that contact information is also listed on the city website. There is a copy of the Parent's Guide to Early Intervention. This is a guide that all families receive when they have that initial meeting with their service coordinator, but you can also find it online before you make a referral if you're interested. And there is a Facebook group for early intervention families that's run by the Department of Health statewide. Quickly giving an overview of Department of Education contacts. This is more relevant to the families transitioning, so those children about to turn 3. Within the Department of Education, there is a office that helps oversee the transition from early intervention. There are transition coordinators, and you can contact them by emailing this inbox, EI to preschool at schools.nyc.gov. The Committee on Preschool Special Education, this is who you contact to make a referral for preschool special education. So to request those preschool special education evaluations that you want to do several months before your child turns 3, you have to contact the DOE. This is something that you need to proactively do. And the office that you contact is based on where you live. So would follow this link to find the office for you. And if you're looking for a early childhood program for your child, including for infants and toddlers, you can contact the Department of Education Early Childhood Programs at esenrollment at schools.nyc.gov for assistance in finding or applying to programs. Okay. So I went over a lot of information. Maybe, hopefully, some of it sunk in. A copy of this presentation, or the recording of this presentation, will be on our website. A copy of the slides will also be on our website. But if you need additional support, please call us with questions. Our helpline, as I said, is available Monday through Thursday, 10 a.m. to 4 p.m. Our number is 866-427-6033. It is toll free. We also have an email address where you can contact us with any questions. For the participants who are joining us live, we will do a quick poll just to see how helpful this presentation was for you. And we'll stay on for a few more minutes as well to answer any questions. I'm just checking the chat. Um, so I do see a question. Can I apply for my son's evaluation on November 15th? I'm not sure what you mean about applying to an evaluation. Um, if you're still present, Esperance, can you elaborate a little bit more in the chat? For a child who was born on November 15th, if you're asking about like referral, if you can apply for services, you can apply to early intervention or preschool special education for that matter. You can make that referral. Now, not knowing what age your child is, it's really hard to understand your question. So apologies. But if your child is still under 3 and you are interested in early intervention services, you can request the referral at any time. If your child has already is about to turn 3 on November 15th, then you may want to make a request for preschool special education services instead of early intervention, just based on age and eligibility. If you already have evaluations scheduled for November 15th, then that's great. Sounds like you're moving forward with one of those processes. Okay, I'm not seeing any other questions in the chat or um, I don't see anything in a Q&A. So thank you everyone for participating. If you've been able to provide us with your email in our exit poll, then I will be able to email you a copy of these slides. Um, if you were not able to provide me with an email address, as I said, the recording and the slides will be posted on our website, so you can check back there. They should be posted later this week.
Betty, if you can please permit me, we have two families. I don't believe I've ever met them before. If you're interested in the Together Growing Strong Care programming, which is a free program from birth up to 7 years of age, if you're interested, I'll drop in here in the chat our a document about our program. If you're interested, you can give us a call, or if you prefer, you can leave your full name and telephone number, and we can call you to enroll you in the program if you're interested. Thank you.
You're welcome. Okay, Esperance, I see. Thank you. You've provided more information that your child was born in 2023. So they are two. They will be turning 3 in April. Um, I'm going to allow you to talk if you want to take yourself off mute, so I can answer your question. I'm still not sure what you want to apply to.
Mm. Hello, can you
Hi.
hear me?
Yes.
Yes. Um, I want to know is possible to make the application for the evaluation to my son for the speech therapy or another thing.
Yes. So you've already requested early intervention services? Or
Yes.
yes, and you have some evaluations scheduled for November 15th?
Yes.
Okay, so if those evaluations don't already include evaluations for all areas of development, then you can make that request that you also want your child's communication skills evaluated.
Okay.
Okay?
Okay.
And so your either your service coordinator or the evaluation agency should
Mm.
be able to support you with that.
Mhm.
If you run into any issues, you can give us a call at our helpline.
Okay.
Okay. Um,
Okay.
and also at that evaluation, the evaluation includes the parent interview, so the meeting with you. So that's another place where you can tell them if you have concerns about communication.
Okay, no problem.
Okay. Good luck.
Thank you.
Okay. Take care. Okay. So thank you everyone for participating. I think that concludes our webinar. Have a great day.
Thank you.